With Germany struggling to contain a massive surge in COVID-19 infections, talk of a vaccine mandate is heating up. In the coming weeks, the new parliament will vote on whether to require all residents to get the jab. In the meantime, Germany's federal and state leaders have decreed that care home workers must get vaccinated. But there are concerns that the measure could lead to serious staffing shortages if they react by quitting their jobs.
Matthias Bussmann has been working as a geriatric nurse for 12 years. He supports the decision to introduce mandatory vaccination for care workers, to keep the risk of infection as low as possible for everyone here.
You feel safer knowing for certain that all of your colleagues, all the people you work with, are vaccinated, and that there are no ifs and buts on that front.
Vaccine hesitancy, or even refusal, has proven a pervasive problem in Germany's care home sector. How pervasive, no one knows. That's why Andrea Jäger welcomes the mandates, but she says they shouldn't be limited to nurses. I would like to see the government move more swiftly to introduce a general nationwide vaccine requirement, instead of just focusing on the sectors that are already under pressure. I don't like the message this sends or the pressure this puts on nurses. You must get vaccinated, while essentially telling everyone else that they can take their sweet time because they're not as likely to drive up infections. A national mandate is under debate, but it wouldn't go into effect until February. In the meantime, to protect the particularly vulnerable, the government is now eyeing a targeted mandate for all nursing home staff, a move welcomed by many in the business. You can't just single out any one group or industry, because there's no way of knowing if they're the ones responsible. There are so many people involved in running a nursing home, from housekeeping to the janitor, from care attendants to those who work in administration and often enter patients' rooms. But some worry that the mix of COVID-19, staff shortages and vaccine requirements are placing too big a burden on workers already stretched to their limits. Those who are still left to shoulder this undue burden are being put under even more pressure. And I worry that this could be the last straw, that they'll go, I can't, I won't do this anymore, and quit. For nurse Matthias Bussmann, though, vaccine mandates are the only way to get out of this crisis. First for care homes and hospitals, then for the rest of the country.
I say vaccinate anyone and everyone, as fast as humanly possible.
Let's talk now to Andrew Ullmann. He's a member of the German Parliament for the FDP and a doctor with expertise in infectious diseases. Dr. Ullmann, how concerned are you that the mandatory vaccination will cause people in the nursing field to quit their jobs?
Honestly, I'm not too concerned. If we look into other countries in Europe, like, for example, France or United Kingdom, we do see some people leaving their job, but on the other hand, most of the people stay there and stay put, and it's obvious that we have an issue there. However, I think it's very important and shows some kind of responsibility if we get the vaccine mandate out there in the institutions. And again, it's not the nursing staff per se, it's all the staff who are working in an institution.
Now, the Bundestag is set to debate a vote on a nationwide vaccination mandate. How sure are you that there will be a majority for it in Parliament?
Well, the first step, what we're starting this week in Parliament, is mandatory vaccination for institutions like hospitals or nursing care or private practice. That has to be first implemented, and the next steps are being debated right now internally, how far we will go with the mandate of vaccination for the whole population or special groups in our population, for example, the elderly or the adults.
Your party, the FDP, has for a long time promised that there'll be no mandatory vaccination nationwide. Many people who voted for you now say they feel betrayed. Others are worried that the divisions in society will get even deeper. What do you say to them?
Well, the truth is all parties said they do not want to have vaccine mandates or mandatory vaccination. I said the same thing, by the way. Even during the campaigning, I said mandatory vaccination is not the route that we have to follow. We have to convince the people. We have to make it understandable why vaccinations are important. However, the situation is getting worse. We are understanding how long a vaccination is helpful, probably just only for 6 months. We need the booster vaccination. We have the Israeli data that shows very clearly how important this third jab is. And we have to get the vaccine into the people right now. And the responsibility is very clear. Our healthcare system is on the edge, especially in certain areas like Saxony or in Bavaria. And that's where we have to show responsibility. And we cannot keep our promises for a situation that got worse.
Now, a member of the Ethics Council is advising against compulsory vaccination and has asked whether the government has done enough to promote voluntary vaccination. In your opinion, has the government done enough?
No, clearly the government didn't do enough. Otherwise, we would be in a totally different situation today. Again, the third vaccination, the third jab, it wasn't put into place or was recommended early enough, despite the fact that Israel was doing that already and was getting out of the way that they were experiencing. And now the new government will probably be put in place this week in our parliament. And I'm pretty sure that we are going to do this differently and hopefully better so that we get in front of the wave and not walking behind the wave. That's the only way that we can get out of this crisis.
All right, Dr. Andrew Ullmann, doctor and member of the German Parliament for the FDP. Thanks very much for your time.
Thank you as well.